And because of a lack of specimens on the day of the practical, a superficial muscle may be cut and you still have to be able to recognize it. But here's our nice big biceps femoris, very thin caudofemoralis. Here we have our flap-like gluteus maximus, our big gluteus medius. Remember, only in hominids is the maximus larger than the medius. And of course, the tensor fascia lata, which tenses the lateral fascia. And on this side, we can also see the sartorius on the off chance it's tagged from this side, which it probably won't be. We can also see down here our semitendinosus. Now, if we look at our deep dissection, let's do superficial and then finish up with deep because we're going to be going all over the place on that one. So here's our sartorius again that we saw on the other side. Here's our gracilis. There again is our thin semitendinosus. The semitendinosus is narrower than the semimembranosus. Here's our pectineus, very tiny, smaller than the blood vessels. Our adductor longus, and then under the gracilis, but you can still see a bit of it here, is the adductor magnus, also called adductor femoris. When we go deep, which we can see as we cut and reflect the gracilis, we have two muscles here. There's our nice big adductor magnus. Again, there's our adductor longus and our pectineus. And here we can see the semimembranosus, which is next to and has a similar name to semitendinosus, but you'll notice again, membranosus is broader. It's easier to differentiate that way. Having cut through the sartorius, we can see our quadriceps groups, vastus medialis, vastus lateralis on the side, and in the middle of the rectus femoris. And we cut and reflect the rectus femoris to see at the bottom of our quadricep group, vastus intermedius. All right, let's take a look at it on the other side now. And let's see. So here, when we go deep again, we can see our vastus lateralis. Here's our semimembranosus, semitendinosus. We've cut the biceps femoris, and in many of these animals, you'll see a thin strap-like muscle, the tenuissimus, which could still be on your practical because it was fair game. When you see it, it'll be a little strand of muscle actually thinner than your sciatic nerve, and I might even on the question make a joke that you may have cut it when you went deep on the biceps femoris. This I would not worry about seeing on the practical from this point of view, but that again is adductor magnus. Here we can see our gastrocnemius. Underneath it on the lateral side, we can see the flexor hallucis longus very well. The soleus fuses to it, so if you pull up on this, I hope you can see that the fiber pattern here is different. It's a bipinnate fiber pattern, that's the soleus, but it's actually easier to see it on the medial aspect of the shin. And then we get to our three peroneus muscles. Always use the big one as your guide, that's the peroneus longus. Behind it we have a smaller looking version of the peroneus longus, which is the peroneus tertius, and between them right on the bone will be the peroneus brevis. So longus, brevis, tertius. I always think of tiny tertius, and B for brevis being right on the bone of the fibula, which is another name for the peroneal group, are the fibularis muscles. Here's our tibialis anterior, and you can see the dividing line between tibialis anterior here and extensor digitorum longus. On the other side, that's not very pretty. Here again, here's our gastrocnemius. Now as we look under it, we can see the soleus much nicer. Really hard to see the flexor hallucis longus from this side. It tilts over to the lateral aspect, but there it is. Here's our flexor digitorum longus. Behind the tibia, tibialis posterior. There's our tibia and tibialis anterior. And that takes care of the kitty cat.